I was thinking, even if not, I'm seeing like, so many people are running around, not getting beds. So I should not take up a bed unnecessarily just because I can. I know it would have been easier probably for me. I felt this was a very, very, cunning opponent. It was like that. And I had to fight it. And I had to fill my mind with positivity.
Hi, I'm Ralph from the Indian Express, and you're watching an exclusive interview with a special guest today. Joining us is actor-turned-politician and Lok Sabha MP of Mandya in Karnataka, Sumalatha Ambareesh, to share her experiences as a COVID survivor and to discuss a bit about her life and thoughts as a people's representative. Welcome to the show, ma'am.
Thank you.
Ma'am, to begin with, so you had actually shared the news that you tested positive for coronavirus on July 6th. And later we were actually delighted to know on July 22nd, if I'm not wrong, that you recovered from the infection. So what would you like to share about your experiences in these days in home isolation and treatment, or how you were taking care of yourself, ma'am, during these days?
Well, I think the first step I had decided, and I was very clear in my mind, that I should share this news as soon as possible. I should not keep this in the dark or keep anybody in the dark regarding this, because I was touring my constituency extensively, and it wouldn't have been fair on my part to keep this a secret. Some people were advising me not to go open about it, but I was very firm on this, that I need to go out and tell people that I have been tested positive. And also I wanted to send a message that it's not a crime, or it's not something that you should be ashamed of.
True.
And definitely I feel very distressed when I see people harassing or humiliating people who have this disease. It's just something which is happening all over the world, and you have to accept and live with it and show some empathy for the people who are suffering from it. It's like the whole world is fighting a war, and you have to fight it. That's it. It's not a crime. You're not a criminal, and there's nothing to be ashamed of. Those were my first thoughts. And the doctor had told me, fortunately for me, my symptoms were on the milder side. So he said home isolation would suffice for me. So that was a big relief for me. And also I was thinking, even if not, I'm seeing like, so many people are running around, not getting beds. So I should not take up a bed unnecessarily just because I can. I know it would have been easier probably for me to get into any hospital, and the treatment process would have been easier for me.
Really
but I have decided that, I'm not going to take up one bed just because I can. And I wanted to do this at home. And I think I was following my doctor's instructions, and he was monitoring me thrice a day, in fact. And from day one, he had put me on medication, which I was following. And it's not easy. I'm not trying to say that it was like a picnic and I was resting or something. I don't want to give any false, impression about this. It's not easy. But you have to fight. There's no choice. There's no option, because once you get it, the main thing is not to let it get to you. I felt at some point when I was in one of my weaker days, as to say, when my fever was very high and body was very, very weak, I felt that this was a very, very, cunning opponent. It was like that. And I had to fight it. And I had to fill my mind with positivity. I had to start talking to myself, which I had never done in my life. So I would get up, close my eyes again and think, okay, this day I'm not going to let this depress me. I'm going to get over this. It'll pass. It has to pass. And I'm going to do everything I can to get over this. That was what was going on in my mind. So I kept my routine as normal as possible in one room. I was not stepping out of the room. I was not seeing anybody. My own son was also quarantined in the room above me. So once in a while, he would come out into the balcony to wave out to me or talk to me on the phone. That was my extent of communication. Apart from that, I had somebody who was leaving my food tray outside my room, and then once I was done, I would leave it outside again. Mm-hmm. So that was my only contact with anybody. And I was doing my saltwater gargling, steam inhalation, thrice or 4 times a day. Okay. I was doing all kinds of, the tulsi water, the kashaya, everything, whatever you have to take. And my doctor had asked me to walk for 6 to 8 minutes and then monitor. I was constantly, this was the most important thing I had to do, constantly monitoring my oxygen levels and my temperature.
You are using an oximeter at home?
Yeah, oximeter. I had an oximeter and a temperature. And one day my fever had spiked to 101 degrees. I think that was the only day which was a little worrisome. Other than that, of course, you feel very exhausted and weak. The smallest task requires a lot of effort. Also, a lot of other symptoms go along with it, and you have to take it. You have to go through, the whole gamut and just get over it. I was having fever, then I developed a cough. There was some kind of a cold. There was body ache constantly, and there were times when I would sleep the whole day, and there were days when I could not sleep at all. So, there were a lot of unpleasant symptoms, but I think, when you think, I was thinking of our soldiers who are there at the border. Okay. They live this life. They live this kind of a life where, they are away from it all, especially when you see, them stationed in remote posts like, say, Ladakh or, Leh or wherever. And the kind of lives they lead, and they don't even know if they're going to return to see their families, and how they fight for the country. So this is a fight for your own life, and you have to do it. So I think that's how I overcame it.
Okay, yes, ma'am. So you were saying you had you were facing some challenges, majorly of sitting alone and then trying to come out from this particular a closed situation, because we know right from day one.
See, that is the biggest danger. One of the biggest dangers in this is depression. You definitely go through depression, which I did as well. I think part and parcel of this, because your body and mind go weak. And your body, yes, you can maybe look at all the medicines and whatever you're going to take, but for your mind you need a lot of positive strength and willpower, and there's nobody else that can do it for you. No doctor can do it for you. You have to do it yourself. So that's why I was constantly telling myself, talking to myself. I was reading books, regarding this, how to be positive in times of distress like this. That helped me, and one positive thing which came out of this is I had the time to go back and start my reading all over again, which I had missed out on all these years.
Okay.
So I think, mine would not maybe apply to everybody who's got COVID-19, because mine were milder symptoms. But even though they were milder, one could feel, the weakness and the depression and the after effect. So really, the people who have severe symptoms have to be very, very careful, and definitely they would need hospitalization. And the other part is people need to be empathetic towards them. I think social responsibility means a lot at this time, and our basic humanity should come to the fore at times like this. And I get so disturbed when I hear that families are not even attempting to even see their, dead, or loved ones last.
So as the Lok Sabha MP of Mandya and Karnataka, can you just brief about the mechanisms in place there at the moment to contain the pandemic now?
see, even before all this, like from 3 months, and whenever I've gone, every place, this is the only thing what I've spoken about to people, and I could see that they had still not taken it seriously. When I was saying keep distance, don't stand next to each other, they would just laugh and think I was like making a joke, or not understand the seriousness of it all. Even when I attended some official functions, I was surprised to see even government employees and people who should be actually advocating awareness regarding this, but not that aware themselves. They were just doing it so easily. The district admin is doing a very, very good job.
Okay.
See, till the lockdown rules were in place, Mandya had next to zero cases. Cases. And then when the lockdown was lifted and people from, it started with the Tablighi, and then it went on to the Maharashtra, Mumbai returnees who were back from there. That exploded really. When they now opened up the borders and the people from Maharashtra and Mumbai especially came. And there's a lot of people in Mandya who work in Mumbai. So I think then it became a little, fast spread. And now with the lockdown totally lifted, there's a lot of movement going around from Bangalore to Mandya and so on. So it is inevitable. That's what I feel. I hope we are moving towards herd immunity, and people get it and get over it. That's how it has to be. Right now, there seems to be no perfect answer for this. But the district admin is doing the best it can. And when it happened, the first thing I did was I diverted 50 lakhs of my MP Lad funds to get ventilators. Even when Mandya practically had no cases, I knew that there would be a time when we would need the ventilators, and we couldn't go placing an order after it happened, after the requirement. So luckily, we got 6 ventilators for the Mandya hospital, and they have plenty of beds. And if you see the number of cases, the number of recoveries are also high in Mandya. So when you look at the active cases, they are much lesser compared to other places. Actually, till a few weeks ago, there was 0 deaths.
True, yes, ma'am. So Mandya is actually just 100 kilometers away from the capital city, Bangalore, where this is the most worst hit district across the state. Bangalore is as of now. So has this actually affected the people's life in Mandya?
Who work in Bangalore?
Yeah. On a daily basis, we can see we have quite a few a share of population who travels from Bangalore to Mandya and then back, or the other way around on a daily basis.
They commute. Yes.
So what are the?
So that's how I think from Bangalore.
What are the steps in place? Having this in mind, have we taken any extra precautionary measures, ma'am, in Mandya?
See, earlier they were doing, I feel, extensive contact tracing and trying to quarantine them. But everybody is learning on the go here. The rules have been changing. The norms and protocols also have been changing. Like earlier, everybody, institutional quarantine was a must. But now, home quarantine is enough, because no government in the world can handle that many patients. And with a population like ours, citizens have to start taking responsibility at some point. Okay, if you're severely ill and you need definitely the support and from the system. But for somebody like me, say, who luckily don't have any other health issues, I should be taking responsibility for myself. I should not be dependent on the system and add pressure and burden onto the already, overburden the system that we have. The government can only guide you and direct you to a certain extent, but the rest depends on us. If you look at other countries in Europe, which were also struggling in far higher numbers than us, now have very successfully brought it down, because the citizens understood the dangers and they have taken their own measures. The government doesn't need to impose lockdown or rules saying, don't stand next to each other, don't hold each other's hand, or don't, stand so close, wear your mask. They are doing it on their own, of their own volition. So our people have to yet learn that. That is something we have to start inculcating by default from now on. Otherwise, you can't keep blaming just the system, just the government, just the lack of hospitals. Yes, there is a lack. There have been lapses, and we need a lot of correctional measures also. But at the same time, the average citizen has to take his or her care of your health at this time, and also take care not to spread. A lot of people asymptomatic without knowing, who can pass it on to a person who might not be able to take the disease so well. So it is your responsibility to wear a mask and maintain the social distance regardless of whether you have symptoms or not.
So right from day one, as an MP from Mandya, we've seen you quite active in your constituency. If you're not there, you're active in Delhi, attending the parliamentary sessions. So in these times, do you think there is a possibility of holding a parliamentary session using video conferencing tools that how we are using right now, ma'am?
Well, they have to come up with some alternate for sure, because right now, the way things are, it is impossible to conduct sessions, because literally, even otherwise, we would always be cribbing about the fact, that it's such a congested and cramped way of seating. I think done some probably 100 plus years ago, it was maybe okay at that time, but it's not changed since then. In fact, in the last session, the speaker, honorable speaker, had mentioned that we are thinking of upgrading the whole Lok Sabha and Rajya Sabha into better seating, and he was asking for suggestions from all the member of parliament. But I mean, that would take a long time, obviously. So in the meanwhile, I think they have to come up with alternate temporary solutions to address this. And I don't know how far something like virtual video meetings could go. It would be a huge challenge to put 543 people in one place. But I'm sure technology might be there to address that challenge, or they have to come up with some alternate.
Mm-hmm. Yet another thing that our Karnataka government has been planning about and trying to incentivize people is survivors coming out and donating plasma. So as a survivor, do you have a possibility of donating your plasma, ma'am?
Yes, I had discussed this with my doctor.
Okay.
I had discussed this with my doctor, and he said we have to wait a period of 28 days from the thing. So I'm waiting for this 28 days, and then they do something called an antigen test to determine the level of immunity and antibodies. And if it's up to it, then yes, I'm going to donate it.
Mm-hmm. So in short, you're trying to say that you should see this particular situation as an opportunity to find yourself and to take care of one another, and to in a way minimize all the stigma around it, ma'am.
Yes, I mean, treat it. I mean, there's no other way, because 15 days or 18 days, you're not going to do anything. So take up some hobby which you can do in your room. Read. Of course, if you have a TV, then you can watch TV, or everybody has a phone. You can do something on the phone. You can learn a new craft, learn a new, take on a new hobby. There's so much one can do, if you, of course, have the means. But even otherwise, you should not let this get the better of you. That's what I'm telling people. You should know that you can beat it, and you should beat it.
Great, ma'am. So we really believe that this particular interview of yours will also generate a lot of courage among people, and also good awareness about this pandemic situation. That was the entire point of us speaking to a COVID survivor who's also popular in the state, ma'am. So great. Thanks a lot for joining us and giving us some time out of your busy schedule today, ma'am. We wish you good health and all the best. Thanks a lot, ma'am, for joining us.
Thank you.